What is a heart attack? Those words are so common, but do we really understand what a heart attack is? My name is Dr. John Cooper, and I'm going to explain in my own words, using some illustrations I created, what a heart attack is. A heart attack is essentially the blood flow to part of the heart muscle gets cut off and part of the heart muscle dies. Some of the signs and symptoms include chest pressure, heaviness, or tightness that might radiate to the left jaw or the left arm. Some associated symptoms might include nausea, vomiting, diaphoresis or sweating, and even shortness of breath. Another name for a heart attack is myocardial infarction. Myo meaning heart muscle, cardio referring to the heart muscle, and infarction meaning tissue death. Let's take a better look at the anatomy to understand this a little bit better. The heart itself sits in the mediastinum, or middle of the thorax. The rib cage outline the outer area of the thorax. The heart muscle pumps blood to the lungs as well as to the rest of the body. There are two atria, a right atrium and then a left atrium, which is behind the heart. And then there's two ventricles. There's a right ventricle and a left ventricle. The heart muscle itself is supplied by the coronary arteries. There is a right coronary artery that arises from the aorta, and that courses in between the right ventricle and the right atrium in the atrioventricular groove. The right coronary artery courses along the back of the heart and then gives rise to the posterior descending heart, which courses between the two ventricles behind the heart. The left main artery courses behind the pulmonary trunk and then branches into two arteries. The circumflex artery, which courses here in between the left ventricle and the left atrium, and it courses around the back of the heart to connect with the posterior descending artery. And then you have a left anterior descending artery that courses in the interventricular groove between the right and left ventricle. Coronary arteries, or all arteries, have three different layers. There's an adventitial layer, or the outermost layer, and that's made of dense connective tissue, which connects the artery to surrounding tissue. There's a middle layer, or the tunica media, which is composed mostly of smooth muscles, which causes the artery to vasoconstrict or become smaller, or vasodilate or become larger. The intima is the innermost layer, and it is a layer of endothelial cells that are attached to the artery through a basement membrane. The intima can be exposed to a lot of different stresses, such as high blood pressure, within the arterial flow. When you have injury to the intima, you get lipids that get through those endothelial cells and into the media. And those are also followed by white blood cells, or macrophages, that become foam cells when they engulf some of the lipids. They start to build up further and further, which causes more inflammation and causes a bulky plaque that starts to form. More and more, if the pressure continues, or if you have other comorbidities such as diabetes, high cholesterol, you can get more and more plaque that continues to form. And the plaque might become significant enough that starts to block the blood flow. The plaque itself usually occurs at branch points where there's a lot of turbulence. When you start to get a chronic plaque, or a plaque that's been there for a while, you start to get calcifications within the wall or within the plaque itself, and they start to become a little bit more firm. But plaques that have a high lipid core, or even a thin fibrous cap, become vulnerable to rupture and block the blood flow further. One of the ways to prevent some of the blood flow from becoming blocked is taking aspirin or Plavix, which helps prevent blood flow from getting, or for preventing the platelets from sticking to the walls and clumping together. What can happen if that plaque ruptures and blocks the blood flow is you can start to get clot that forms in the artery. This completely blocks the blood flow going through the artery from getting to part of the heart muscle. When that occurs, you can start to get the heart muscle that dies right in the vicinity of where there's a lack of circulation or lack of oxygen. And then you might have some cells outside of that that are sort of stunned in the region. When this happens, the heart muscle becomes very weak and can't pump effectively, and then starts to become backed up, which could lead to congestive heart failure. There's definitely some treatments for a heart attack, and those treatments are all focused at getting more blood flow through those arteries to supply the heart muscle, so it allows it to pump more effectively. Thank you.